I would like to purchase some health insurance.
Have you ever purchased health insurance before?
I have health insurance now, but I want to look into other choices.
Do you know if you're interested in an HMO or a PPO?
Could you explain the difference to me?
To clarify it for you, with a PPO, you may pay more, but you get to choose your own doctor.
When I pay for a service, is the payment the same for a PPO or HMO?
The payments are quite a bit higher for the PPO, but you can go anywhere you like.
How much will an HMO cost me per month?
Go to our website and fill in the questionnaire. Once we have all of your information, we can give you a quote.
I'm calling to purchase health insurance.
Do you have health insurance now?
I was on my parents' policy, but I need to start buying my own.
You can purchase an HMO or a PPO. Do you know what you want?
I don't know what I want.
Let me explain it to you. An HMO is a little cheaper, but you can only choose certain doctors.
When I go to the doctor, do I pay the same out-of-pocket expenses for a PPO?
The payments are a little lower for an HMO, as long as you go to their doctors.
How much will a PPO cost me per month?
We need to factor in many things. Why don't you come in and we will have you fill out a questionnaire? I need information on purchasing health insurance.
Is this the first time you have had health insurance?
This is my first time buying health insurance.
You have a choice of HMO or a PPO. Do you understand the difference?
I am not sure what those are.
Just so you understand completely, an HMO is a little cheaper, but you have limited choices of which doctor you choose.
If I need to use my insurance, are the payments the same for a PPO and HMO?
By going to the providers on the HMO list, you save money in out-of-pocket expenses.
Can you give me a comparison between a PPO and an HMO?
We can mail you a questionnaire, and when we have all of your information, we'll mail you a quote. What seems to be the problem?
Oh my God, it's my stomach. It's killing me.
Where does it hurt the most?
Right here. It hurts right here.
How long has it felt like this?
It felt okay when I woke up, and then suddenly I had this really sharp pain.
Do you have a history of stomach pain?
No, and I haven't done anything out of the ordinary.
Well, I think that we're going to have to get you into an emergency room right away.
Thank you for helping me. Can you tell me where it hurts?
I'm so glad they called you. It feels like something is really wrong with my stomach.
Does it hurt when I push here?
It's mostly on my right side, right here.
Have you been feeling this way for a while?
I started feeling kind of sick last night after dinner, but this morning the pain got really bad.
Have you eaten anything unusual lately?
No, not that I can remember.
We are going to take you to an emergency room right now.
I will feel better when I know what the problem is. Thank you for the drugs. Where are you feeling the pain?
I can't stand up. My stomach is killing me.
Can you put your hand where it hurts the most?
It hurts smack in the middle of my gut.
Did this just come on suddenly?
I felt okay until an hour or so ago, and then I just doubled over.
Have you exercised strenuously or played sports recently?
No, I don't usually get a lot of stomach aches.
We need to get to an emergency room to see what the problem is.
I think that is the best way to figure out what is causing this. Thank you. Sorry to bother you, but I was wondering if you could drive me to the emergency room.
Of course. What is the problem?
I am running a really high fever of 105 degrees, and I have a rash on my stomach.
If you can, go and unlock the back door so I can get in when I get there if you fall asleep.
I can do that when I get off the phone.
Do you know where your driver's license and insurance card are?
I already had them out before I called you.
Where is your nearest emergency room?
It's just a few blocks away.
Fine, I'm on my way. I'll be there in about 5 minutes. I hate to call you this late at night, but could you possibly help me to get to the emergency room?
We will come right over. What happened?
My temperature went up to 105 and I have a rash.
Make sure that someone unlocks the back door so I can get in if you fall asleep before I get there.
I will do that in a minute.
Make sure that you have your insurance card and driver's license where we can grab them.
I know right where they both are.
Is there an emergency room near you?
It is on the other side of town, next to City Hall.
I am on my way. Give me 10 minutes and I'll get to you. I really need your help and want to know if you could drive me to the emergency room.
I will take you there right away. What's wrong?
I woke up with a rash and a temperature of 105.
I want to be able to get to you when I get there. If you can unlock the back door right now, that would be great.
I will make sure that I do that before you get here.
Also, make sure that we have your driver's license and insurance card before we leave for the emergency room.
I'm getting them out while I'm speaking to you.
Do you know where your nearest emergency room is?
It is near the bridge that crosses over the river.
I am driving to you even as we speak. Hang in there. You don't look so good.
I have a major stomach ache.
Did you eat something strange?
I had spaghetti with clam sauce for lunch.
Maybe you have food poisoning.
Yes, that could have been it, but I haven't been feeling that great for the past few days.
Are you under a lot of stress?
Not really. Things have been going okay.
Maybe you have a touch of the flu.
I think that I might be getting the flu. Are you feeling okay?
My stomach is bothering me.
What have you been eating?
I had a ham sandwich with mayonnaise for lunch.
Maybe the food had something wrong with it.
It could be bad food, but I didn't feel so well yesterday either.
Have you been under a lot of pressure lately?
I haven't been under any more stress than usual.
Perhaps you have caught that bug that is going around.
I feel like maybe I'm coming down with the flu. You look kind of green.
I don't feel so good. I am feeling sick to my stomach.
Have you had anything to eat lately?
I had fried shrimp and clams for lunch.
Perhaps the food was bad.
Perhaps, but I haven't felt well for a few days now.
Has anything been upsetting you lately?
My stress level is pretty much what it usually is.
Do you think that maybe you're getting the flu?
It seems to me like I may have caught a bug.
Doctor, I have the worst toothache.
How long have you had this pain?
For about a week or so, but it's gotten really bad in the last couple of days.
Did you do anything that might have aggravated your tooth?
You know, I was eating Jawbreakers in the movies the other day, and I accidentally bit down really hard on one.
What kind of toothbrush do you use?
I just use a regular hard bristle toothbrush.
Does it bother you when you eat something really cold?
Yes, it definitely bothers me more when I do that.
So, what brings you to my office today?
My tooth is killing me.
How long has your tooth been bothering you?
It just started hurting me last night.
Have you injured your tooth in any way?
I think one of my fillings might be coming loose.
Do you have a special kind of toothbrush that you like to use?
I have an electric toothbrush.
Does it bother you when you eat something really sweet?
Oh yeah, when I do that, it hurts a lot more. How have you been doing?
I can't sleep or eat. I have a really bad pain in my tooth.
How long have you had this toothache?
It bothers me off and on, but it's gotten much worse these past few weeks.
Is there anything that you've done to your tooth that might have caused the pain?
My girlfriend told me that I grind my teeth a lot when I sleep. Maybe that's the problem.
When you brush your teeth, what do you use?
I use a soft bristled toothbrush.
Does it bother you when you have to chew a lot?
Absolutely. That set it off big time.
Excuse me, could you help me pick out a lotion?
Sure. What is the problem?
I got poison oak while hiking, and I need something to help me with the itching.
I can suggest a product called Technu that comes in a lotion or cream.
Which do you prefer?
Hikers tell me that the cream is best because it stays on longer.
Is there anything else I can do to help with the itching?
You can take an antihistamine.
Thank you so much for all your information.
You are welcome. Please feel free to ask me a question anytime you need help. I need help picking out a lotion.
It would be my pleasure to help. What do you need help with?
I picked up some poison oak while hiking and I can't stop itching.
We have Technu, and it's available in lotion or cream.
Do you find that one works better than the other?
I have heard that the cream is longer lasting.
Is there anything I can take that will help with the itching?
If you take an antihistamine, that would help a lot.
Thank you for helping me figure out what to do with my poison oak.
It was my pleasure. Come back anytime. Can you help me find the lotion for a problem I'm having?
That's what I'm here for. What questions can I answer for you?
I have poison oak and I need help with the rash that won't stop itching.
The best product is Technu, and you can buy either the lotion or cream.
Which one is best?
The cream form is very popular.
Can I do anything else to help with the itching?
You could also take an antihistamine to help the rash go away quicker.
I appreciate you helping me find a solution to the itching.
Anytime you have a question, please feel free to ask.
I need to get my prescription filled.
You may pick it up in 20 minutes.
If I wanted to, could I have it mailed to me?
Yes, and you can renew this prescription by phone.
Are there any special instructions about this medication?
Take it 3 times a day.
Can I take it with food?
You should take this medicine with food and no alcohol.
Are there any side effects with this medication?
You might get a little dizzy, but that is it. I am here to get my prescription filled.
Your prescription will be ready in 20 minutes.
Do you ever deliver prescriptions by mail?
Yes, in fact, you can renew this prescription over the internet and have it delivered to your home.
How should I take this medication?
You should take it twice a day.
Should I avoid alcohol with this medication?
You need something in your stomach when you take it. Don't drink alcohol with this medication.
Should I expect any side effects?
Sometimes you might feel dizzy, but that isn't common. I'm dropping off my prescription to get it filled.
You can come back in 20 minutes and it will be ready.
If I couldn't wait, could the prescription be mailed to me?
Yes, you can have it delivered or filled at any location in our HMO.
When should I take this medication?
You need to take it at bedtime.
Should I take this medicine on an empty stomach?
Don't mix alcohol with this medication, but you can take it with or without food.
What are the side effects of this medication?
You might feel a little dizzy at first, but it should pass.
Hi, I was wondering if you had my test results in.
I didn't see anything out of the ordinary, but I want you to log onto our website for a printout of all of the details.
So basically, I am okay?
If there were any major problems, I would always notify you by phone to come in.
What will I learn when I see the results on the website?
A description of each test is given on the site.
What will the numbers tell me?
The website will give you a normal range and then tell you what your results are.
Are all of my test results on that site?
Your entire test history is on the site. You can compare your results from over the years. Hello, could you tell me my test results?
Your results are posted on the website. Just put in your password and you can see the exact numbers.
Are you saying that all my results were normal?
We always contact you by phone to come in if there is a need for follow-up.
How will I know what the results mean on the website?
The purpose of each test is given on the site.
Will the numbers mean anything to me?
The website will give you your results and then tell you what the normal range is.
Can I see all of my test results at once?
Yes, you can see every test for the past 5 years. You can compare them. Hi, I think I'm supposed to call for my test results today.
If you go onto our website and put in your password, you can access your test results.
Are you saying that there weren't any problems?
I will always have you come in for a discussion if there is a major problem.
Will I be able to read the results on the website and understand them?
Yes, if you go there, you can see what each test is about.
How will I know what the numbers mean?
You can see your results and how they compare to the normal range.
How can I see test results from tests I have taken before?
We put all of your test results up in the same place. Just check the dates for what you need.
Good morning. Is this Ryan?
You are speaking with Ryan. How can I help you?
Ryan, this is Malia, and I need to call in sick today.
What seems to be the problem?
I went hiking and have terrible poison oak.
When did you get that?
Oh, I think I got it on Saturday, but it just showed up today.
What are you doing for it?
The doctor prescribed an ointment and gave me a shot.
Good. You probably should be much better by tomorrow.
Hi, may I speak to Ryan, please?
This is Ryan you're speaking with. What can I do for you?
Hi, Ryan. This is Malia, and I will not be coming to work today.
What is wrong with you?
I have really bad poison oak, and I can't stop itching.
How long have you had it?
I've had it a few days, but the rash really got bad last night.
How have you been treating it?
I have some lotion that the doctor gave me as well as an antihistamine.
That should work. I'll see you tomorrow when you return to work. Hello, I'd like to speak with Ryan.
This is Ryan. How may I help you?
Ryan, this is Malia, and I'm afraid that I'm feeling a bit under the weather.
Do you know what the problem is?
I have a horrible rash from poison oak.
Have you had it a long time?
The doctor said that I probably have had it a few days.
Have you been using anything for it?
I bought some over-the-counter lotion, and I'm taking an antihistamine.
That will probably take care of your symptoms. I'll see you tomorrow.
Hi, is this Professor Clark's office?
This is Professor Clark speaking.
Hi, this is Kalia from morning literature class.
Yes, what can I do for you?
I had a skydiving accident over the weekend and won't be able to come to school today.
My goodness, are you okay?
I broke my leg, but it is healing.
How long will you be out of class?
I should be able to return by next Monday.
Fine. Well, thanks for calling and let me know you will be absent. I hope you feel better soon.
Good morning. May I speak with Professor Clark, please?
You're speaking with Professor Clark?
Professor, I am Kalia from your morning literature class.
Yes, how can I help you?
I ran my car into a tree yesterday and need to miss a few days of school.
Oh my God! I hope you're all right.
I have a concussion, but I will be okay.
How much school will you be missing?
I only need to take this week off.
I appreciate you calling and telling me that you won't be in class. See you next week. Hello, is this Professor Clark?
Why, yes, I am Professor Clark.
Hello, Professor. This is Kalia, and I'm in your literature class on Monday mornings.
Yes, how are you doing?
I was partying hard over the weekend, fell down the stairs, and I need to recuperate.
That sounds painful. Are you going to be okay?
I sprained my wrist, but the doctor says it will be fine.
How many days will you be out of school?
The doctor said I should be good enough to return next week.
I'm glad you let me know that you will be missing class. Get well.
Hi, I was wondering if I could get my test results from the other day.
Yes, I would like to schedule an appointment for you to come in and talk with me.
Is something wrong with me?
No, sometimes the test results aren't clear, and we need to do more to get a clearer picture.
Can we talk about it now?
I would if I knew anything for sure, but I want to take a second look.
When can I come and see you?
You can come in this afternoon. If you would feel better, bring your husband with you.
Now I know that something bad is up.
Just relax. We will talk about it this afternoon.
Hello? The nurse said that you might have my test results in from the other day.
I would like for you to come in and talk about a few more tests that I would like to run.
Does this mean that you have bad news for me?
I just want to talk to you about the tests that I want to run.
Can't you just tell me now?
I don't know anything for certain. We always do a double check if there is a question.
I want to see you right away.
You could come in this afternoon. If you're feeling too stressed, feel free to bring a friend along.
I know for sure that something is wrong.
Don't worry about a thing. We are just taking a second look and talking. Hi, the lab said that you would be getting my test results in today.
I'd like you to come in and discuss some further tests that I would like to run.
I think that is a bad sign.
For now, I would like to run a few more tests to look into some of the problems they mentioned.
Why wouldn't you tell me over the phone?
If there's any question about test results, we always do a recheck.
I need to come in right away.
I would be happy to see you this afternoon. If you're feeling upset, please bring a friend or relative along.
You are scaring me.
Come on in this afternoon and we'll talk. It will be fine. Hi, I have a doctor's appointment scheduled with Dr. Smith and I need to change it.
What day did you have it scheduled for?
My appointment was on Tuesday.
What time was it scheduled for?
It was for 2 o'clock in the afternoon.
I see your appointment. What day would you like to switch it to?
I would like to switch it to next Friday.
What time would you like?
I would like to come in at 10 in the morning.
Fine. I will pencil that in right now. We will see you then. Hello, I scheduled an appointment with Dr. Smith, and I can't make it on that day.
What day was your appointment on?
My appointment was on Monday.
What time had you chosen?
It was for 10 in the morning.
I am looking at your appointment right now. What day would you prefer?
I would prefer next Thursday.
What time would be best for you?
I want to come in at 2 o'clock in the afternoon.
I'm writing you down for that time. We look forward to seeing you. Good morning. I made an appointment with Dr. Smith, but I have to change it.
When you made your appointment, what day did you choose?
My appointment was on Wednesday.
At what time was that appointment?
It was for 4 in the afternoon.
I could see the appointment that you had. What day did you need to change it to?
I want to change it to next Tuesday.
What time would you prefer?
I would prefer 3 o'clock in the afternoon.
I'll put it down for that time. Thank you for calling to reschedule.
Professor, excuse me, but I need to leave early.
What seems to be the problem?
I am not feeling well.
What is bothering you?
I think I'm beginning to have an asthma attack.
Would you like someone to walk you over to the student health center?
No, I think I should just go home because I have some medicine there.
Do you need a ride home?
I live in the dorms across the street, so I'll be okay.
Okay. Then hope you feel better soon. Check your email for missed assignments.
Excuse me, Professor, I need to go home now.
Is everything okay?
I just feel funny.
What exactly seems to be the matter?
I have a terrible headache.
Do you think that you should go to the student health center?
I already have some medicine at home if I could just get there.
Do you need someone to drive you home?
Thank you, but the bus stop's right at my house.
Well, go home and rest up. Make sure you check the website for assignments. I'm sorry, but I cannot stay for the rest of class today.
Why do you need to leave early?
I don't feel so good.
What doesn't feel right?
I feel as if I'm going to be sick to my stomach.
Perhaps you should get checked out at the student health center before you go home.
I have some medicine at home that I could take.
Are you going to be okay to drive home, or would you like someone to go with you?
Thank you, but my friend is in the library and he can give me a ride home.
We hope that you are feeling better soon. Email me if you have any questions. The doctor sent me over here to have my blood drawn.
Certainly. Please have a seat and roll up your left sleeve.
What is this test for?
Well, today your doctor wants to check your white blood cell count.
What does that tell him?
Well, if it is elevated, you might have an infection.
Will the blood test hurt?
It is only a little pin stick. I'm going to put on a tourniquet on your arm to puff your veins up.
Ouch!
There we go. I got the blood that I needed. My doctor says that I need a blood test.
I can help you with that. Just have a seat and roll up your left sleeve.
What are you taking my blood for?
Your doctor has requested a check of your white blood count.
What information does that give him?
If your white blood cell count is off, it could signal an infection somewhere in your body.
Is a blood test painful?
I'm putting a tourniquet on your arm to plump up the vein. It will only feel like a little pinprick.
Oh, my God, that hurts.
That was it. Thank you for coming in today.
I came to this lab to have my blood drawn.
You're in the right place. Roll up your left sleeve and have a seat.
What am I being tested for?
Your doctor wants to know what your white blood cell count is.
What does my white blood cell count tell him?
Usually if your white count is off, the doctor suspects an infection.
How much will it hurt?
It's only a pinprick. I have to put this tourniquet on your arm to make the vein easier to find.
Is that my blood going into that tube?
That blood that just filled the tube is all that I needed. Thanks for coming in.
I came to this lab to have my blood drawn.
You are in the right place. Roll up your left sleeve and have a seat.
What am I being tested for?
Your doctor wants to know what your white blood cell count is.
What does my white blood cell count tell him?
Usually, if your white count is off, the doctor suspects an infection.
How much will it hurt?
It is only a pinprick. I have to put this tourniquet on your arm to make the vein easier to find.
Is that my blood going into that tube?
That blood that just filled the tubes is all that I needed. Thanks for coming in.
You don't look so good.
I feel horrible. I think I picked up a bug.
Do you know who you got it from?
Oh, a lot of people in my dorm are sick. Perhaps I picked it up there.
Do you take any cold medication?
I've been taking vitamin C and zinc and trying to get some rest.
I think that rest and liquids are what doctors recommend for a cold.
My grandmother swears by a hot chicken soup for a cold.
A pharmacist might be able to help you if your home remedies don't work.
Yes. If I get worse, I will definitely look for extra help with this. You look a bit under the weather.
I'm not feeling all that great. I think I have that crud that is going around.
I know that it's going around the dorms.
My boyfriend hasn't been feeling so well. Maybe he passed it on to me.
I have some cold tablets if you'd like one.
Mostly, I feel like I need some rest and hot soup.
Drinking liquids and getting rest is a good idea with a cold.
My grandmother thinks that honey and whiskey is got a cure for the cold.
You could always go to the pharmacy if it gets worse and if you want suggestions.
If things don't get better in a few days, I will look for some other solutions.
Hi, I need to make an appointment to see the doctor.
What seems to be the problem?
I have a rash that I need a doctor to look at.
Ugh. Do you have a fever with that rash?
No, it just itches a lot.
I have an opening on Tuesday or Wednesday. Which would be best for you?
I need an appointment on Tuesday.
Fine. I am putting you down for 9 o'clock on that day. Would you like to see Dr. Smith or Dr. Jones?
I would like to see Dr. Jones.
I can schedule you with him with no problem. We look forward to seeing you.
Good morning. I would like to make a doctor's appointment.
Can you describe your health concern?
I have been having skin problems that aren't going away.
Are you in pain?
No, except for the rash. I feel fine.
Would Tuesday or Wednesday be best for you?
I'd like to come in on Tuesday.
I will write you in for that day at 4. You can see either Dr. Smith or Dr. Jones.
I'd like to see Dr. Smith.
I will write you in on the doctor's schedule. See you then. Hello. I need to come in and see the doctor.
Are you scheduling a checkup or are you ill?
I have really itchy skin and think I have to have it looked at.
Have you been feeling any joint aches with that rash?
No, but I have a low fever.
I have times available for Tuesday or Wednesday. Which one would work best for you?
I want to come in on Wednesday.
I can fit you in on that day at 10 o'clock. Dr. Smith or Dr. Jones is available.
I would prefer Dr. Smith.
You can see the doctor of your choice then, and we will see you at your scheduled appointment time.
Have you been having any problems lately?
No, but the nurse at school says that I should have my blood pressure checked.
Do you have a history of high blood pressure?
No, I have never been told that I have high blood pressure.
High blood pressure is called the silent killer because it hardly ever has symptoms.
How do you check for high blood pressure?
We are going to use this cuff here and it will give me a reading.
What do the numbers mean?
They tell me how much your heart is working at the rest and when pumping blood.
Good. That will help me know how I am doing. How have you been feeling lately?
I've been feeling a little lightheaded lately.
Has your blood pressure been high before?
If I have high blood pressure, it is news to me.
Usually people with high blood pressure have no symptoms, so we call it the silent killer.
What do you use to check for high blood pressure?
I'm going to put a cuff on you to get a reading.
What does the reading tell you?
I get an idea of the pressure in your arteries when your heart is pumping blood versus at rest.
I hope that the test results show me to be really healthy.
Have you been feeling okay lately?
My coach wants you to check my blood pressure.
Has anyone ever told you that you had high blood pressure?
I don't have any symptoms of high blood pressure.
People with high blood pressure seldom know they have it, which is why we call it the silent killer.
Oh, what test do you do for high blood pressure?
We will pump air into this cuff to get a reading.
When you get the reading, what information does it give you?
It tells me how hard your heart pumps blood and how much your arteries relax at rest.
I'm hoping that this test goes well for me. How are you feeling today?
I'm pretty tired. I haven't been sleeping well.
Do you have enough time to get the right amount of sleep?
I have enough time. I just can't seem to fall asleep and stay asleep.
What time do you usually go to bed?
I don't have one time in particular. I just go to sleep whenever I feel tired.
Have you been under a lot of stress lately?
I just lost my job, and I am unsure about being able to find another one.
Have you ever tried doing relaxation exercises before you go to bed?
I haven't ever tried that, but it sounds like a good idea.
How have you been doing lately?
Actually, I haven't been sleeping well. I'm kind of out of it.
Is there some reason why you can't get enough sleep?
I go to bed, but I just can't get comfortable enough to stay asleep.
When do you turn in for the night?
I usually try to go to bed around 11 or so during the week.
Do you have a lot on your mind when you try to go to sleep?
My mother is ill with cancer, and I think about her a lot.
Do you ever meditate or read before bedtime?
I usually watch a lot of television before I go to bed. Maybe I should try something else to help me quiet down. Has everything been okay with you lately?
I haven't been able to get a good night's sleep lately. I'm exhausted.
Have you been too busy to get enough sleep?
I try to go to sleep, but I just can't stay asleep.
How late do you try to go to sleep?
I go to bed when I finish my work.
Has anything in your day-to-day life been bothering you lately?
I'm worried about how I am going to pay my tuition.
You might consider listening to relaxing music as you go to sleep to clear your head.
Doing something relaxing before I go to sleep sounds like a plan. Good morning. How are you doing today?
I've been feeling pretty good, Dr. Smith.
So, I can see by your chart that you are here for your annual physical.
Yes, I am playing on the tennis team this year, and they're requiring me to get a physical exam.
We are basically going to check your heart, lungs, blood sugar levels in eyes, ears, and nose.
I've been kind of having problems being out of breath. Can you look at that?
Yes, I will check for your asthma. And maybe we can check for your allergies later.
Thank you. What will the blood test tell you?
We'll be checking for blood sugar, cholesterol, and white blood cell count.
I have been working hard to stay healthy. I hope that the tests turn out well. Hello! So how are we feeling today?
Things are going well for me, Dr. Smith.
Am I correct in thinking that you are here for your annual physical?
Yes. I'm applying for new health insurance, and I need a physical examination to qualify.
Your basic physical exam will include lungs, heart, blood levels, and eyes, ears, and nose.
I've been having a little trouble breathing. Would you look into that, please?
We can do an allergy test, and later I can send you for an asthma test.
I would appreciate it. When you give me a blood test, what are you looking for?
I'm going to check your cholesterol, blood sugar, and white blood cell count.
I'm expecting the test to go well. I have been taking good care of myself. Nice to see you. How have you been feeling lately?
I've been feeling great, Dr. Smith.
I'm happy that you have decided to come in for your annual physical.
Yes, I'm going on a cross-country bike ride on vacation and want to make sure that I don't have any problems.
We're going to look at your heart and lungs, do a few blood tests, and see that your eyes, ears, and nose are all working as they should.
I've been having trouble with congestion in my chest. Can you give me some tests for that?
I can do a chest Xray to check for congestion.
That would be great. What is the blood test for?
The blood test is for cholesterol, white blood cell count, and blood sugar.
I've been feeling great. I don't imagine that any of my tests will turn out badly.
Hello, I need a doctor's appointment right away.
Is this an emergency?
I am having trouble breathing.
Have you had a cold lately?
It has been going on for a few days now.
You should hang up and dial 911.
I don't think that this is that bad, but I need to see a doctor right away.
Is there someone who can drive you to our urgent care facility on Sunset Boulevard?
Yes, I can get a ride to urgent care.
Good. When you get there, a doctor will be able to see you right away. Hi, I need to see a doctor soon.
Do you feel this is an emergency?
My chest feels tight and I can't catch my breath.
Did this come on suddenly?
It started yesterday.
If you feel this is a real emergency, you should dial 911 for the paramedics.
I don't want to dial 911, but I want to see a doctor right now.
Do you have transportation to our urgent care facility on Sunset Boulevard?
My friend can drive me to urgent care.
That will work out well. Remember, if you have a major problem, call 911. Hello, I have to see the doctor right now.
What makes you feel this is an emergency?
I feel like I can't breathe well.
How long has this been going on?
It started last night.
In the event of a real emergency, please dial 911.
I know that I can dial 911, but I just want to go to the doctor now.
In that case, can you come to our urgent care facility on Sunset Boulevard?
My family can bring me to the urgent care.
Come in right away, and they will see you as soon as possible.
I was told to come to you to get a chest x-ray.
No problem. Just take your clothes off from the waist up and put the gown on with the opening in the back.
Then what should I do?
You will stand over here up against this plate.
Should I just stand naturally?
You will raise your arms up shoulder high.
Is this all right?
Yes, you are doing great.
Where will you be going?
I need to stand behind this shield. Now you will take a deep breath, hold it, and let it out.
Is that it?
That's it. You can get dressed when the film is developed. My doctor said that I need a chest x-ray.
Just take your clothes off from the waist up and put this gown on with the opening in the back.
What should I do after that?
You need to come over here and face this plate.
Am I standing the right way?
I will need your arms raised to shoulder height.
Am I doing this the right way?
Everything you are doing is perfect.
Are you going to leave?
I am just getting behind the screen. You need to take a deep breath, hold it, and then breathe normally.
Is that all there is to it?
You can get dressed as soon as the film is processed. We will be all done here. I came here to get a chest x-ray.
I will need you to take your clothes off from the waist up and put on the gown, leaving the opening in the back.
What comes next?
I will need you to face this glass plate right over here.
Should I do anything else?
Your arms need to be raised to shoulder height.
Is this okay?
So far, so good.
How come you were walking away?
I am not leaving. I just need you to take a really deep breath, hold it, and then let it out.
Will I be finished then?
You will be able to put your clothes on as soon as I have checked the film.
I've been having a lot of headaches lately.
Have you been having these headaches for a long time?
I have had headaches my whole life, but they have been getting worse lately.
Have you been under a lot of stress lately?
I've been under stress, but no more than usual.
Have you been getting enough sleep lately?
No, I only sleep a few hours a night.
Have you had any head injuries lately?
Yes, actually, I fell skiing last week and hit my head.
I am going to send you for a CT scan, and I will see you again when we see the results. I have been getting headaches almost every day lately.
Have you just started getting a lot of headaches?
I never had very many headaches before, but the last few weeks I have been getting a lot of them.
Have you had any unusual, stressful situations in your life lately?
My mother just passed away last Tuesday.
Oh, I'm sorry. How about sleep? Are you getting enough rest?
I have been working really hard, and sleep has not been a priority.
Have you bumped your head or fallen lately?
No, I haven't hit my head.
I'm going to send you to a neurologist for a few tests. I've had some really horrible headaches lately.
How long have your headaches been going on?
I get headaches occasionally, but they have been really bad lately.
Any unusual amounts of stress in your life going on right now?
I'm getting ready to take my GRE.
Have you been able to sleep regular hours?
It has been hard for me to sleep with a bad headache.
Has anything hit you in the head lately?
I hit my head on a cupboard door a week ago.
Let's have you come back in a few days and see how you feel.
Hello, how are you doing today?
I've been having trouble breathing lately.
Have you had any type of cold lately?
No, I haven't had a cold. I just have a heavy feeling in my chest when I try to breathe.
Do you have any allergies that you know of?
No, I don't have any allergies that I know of.
Does this happen all the time or mostly when you were active?
It happens a lot when I work out.
I'm going to send you to a pulmonary specialist who can run tests on you for asthma.
Thank you for your help, doctor. Hi, what brings you to my office today?
I've been getting really short of breath, and my coach wanted to have a doctor check me out.
Have you had the flu lately?
No, I've been pretty healthy. I just have trouble taking a really deep breath.
Have you ever been tested for allergies?
Peaches make me break out, but I don't have any other allergies.
Does this happen all the time, or maybe a little more in the cold weather?
I've noticed that it is worse when I am under stress, like during finals week.
I feel that you should see a pulmonary specialist to check for asthma.
I appreciate that referral, doctor. Good morning. How have you been doing?
I haven't been able to take a deep breath lately, and I need to know why.
Have you had any type of bug lately?
No, I've been feeling fairly good most of the time. It just is hard to breathe.
Has anyone ever told you that you have allergies?
No one has ever checked me for allergies.
Does this happen more when you are under stress?
When the weather gets really cold, it gets worse.
I'm going to refer you to a pulmonary specialist who can run tests on you for asthma.
Thank you for pursuing this. I appreciate your help.
What is that plastic cup for?
Your doctor has requested a urine sample.
I'm supposed to pee into the cup?
We want what we call a clean sample. Urinate a drop or so into the toilet, and then stop the flow and urinate into the cup.
Then what do I do with the cup?
You put the cup in the little cubby in the restroom and close the door to the cubby.
What is this test for?
He is looking to see if you have a bladder or urinary tract infection.
When do I know the results?
Your doctor will call you in a few days with the results. Why are you handing me a plastic cup?
Your doctor wants to test your urine and needs a sample.
How am I supposed to do that?
We need you to urinate like you normally would, and then stop and finish into the cup.
What am I supposed to do with the cup when I'm done?
Leave the cup in the cubby in the restroom. Just close the cubby door and walk away.
What kind of test is this?
He wants to know if you have bacteria in your urine, which could signal an infection.
How long will it take to get the results?
We will send your doctor the results and he will contact you. What am I supposed to do with this plastic cup?
That cup is for a urine sample.
How exactly does this work?
This particular test calls for you to urinate into the cup after you have urinated a little into the toilet.
When I finish, what should I do then?
You need to leave the cup in the cubby in the restroom, and the lab tech will get it from the other side.
What is my doctor testing me for?
If there are bacteria in your urine, it could mean an infection somewhere.
Will I know the results right away?
Your doctor will be contacting you with the results.
Doctor, can you give me some suggestions on how to stay healthy?
Well, first of all, you need to make sure that you eat the right foods.
What are the best foods to eat?
You should emphasize fresh fruits and vegetables, along with whole grains and protein.
What should I avoid?
You need to avoid highly fatty and greasy foods. You should also avoid too much sugar and caffeine.
What else is important to stay healthy?
You need to get plenty of exercise every day. If you smoke, you need to stop.
Is it okay to drink alcohol?
Actually, studies have shown that people who have 1/2 a glass of alcohol per day do better than those who don't drink. Doctor, what is the best way to stay healthy?
Having a good diet is probably the most important thing.
It is very confusing to know what to eat.
You need plenty of fruits and vegetables, small amounts of protein, and whole grains.
Are there certain things that I should avoid?
You shouldn't consume too much sugar or caffeine. Also, watch your intake of fatty food.
After watching my diet, what else should I do?
You need to stop smoking and make sure that you get 30 minutes of exercise every day.
Can I have a glass of wine now and then?
As long as you don't overdo it, a glass of wine a day should be okay. Doctor, what are some things that I can do to stay as healthy as I can be?
You need to eat healthy foods and avoid unhealthy foods.
Sometimes I don't know what the best foods are.
Fresh fruits and vegetables are important, along with protein and whole grains.
What things should I avoid?
You don't want to eat food that is high in fat. You need to avoid caffeine and sugar.
Beyond diet, what else can I do to be healthy?
Getting 30 minutes of exercise a day is important. If you smoke, you need to stop.
How about having a beer on the weekend?
Less than a serving of alcohol a day can actually be good for you. Do not overdo it.
Is there a medication you can prescribe to help me with my problem?
There are various choices of blood pressure medication that we can try.
What is available?
We could start with hydrochlorothiazide, which is a diuretic.
Are there many side effects?
There really are not many side effects. You need to drink a lot of water when you take this pill.
Is that the only medication I need to take?
It might be, but for a while, I also want you to take an ACE inhibitor, lisinopril.
What are the side effects of that drug?
You may have a little bit of a dry cough, but you will feel much better. Can I get some medicine to help me?
For high blood pressure, we have several choices of medications.
What types of drugs can I try?
Hydrochlorothiazide is a diuretic that helps you with water retention.
What about side effects from that medication?
Most people have no side effects. You will have to make sure that you drink plenty of liquids with this medication.
Do I only need to take that one drug?
I'm going to add a second drug for now, lisinopril, which is an ACE inhibitor.
What can I expect when I take that medication?
You will feel much better except for the fact that you might have a little cough. What about a medication to help me with my problem?
There are several types of medications that we can try for your high blood pressure.
What type of medications would be best?
For water retention, I'm going to start you on hydrochlorothiazide, which is a diuretic.
What are the side effects from taking that drug?
You need to stay hydrated on this drug, but most people experience little side effects.
Will that one medication take care of all my problems?
For now, I want you to take a second drug, lisinopril, an ACE inhibitor.
Am I going to experience any complications with that drug?
The most you will experience will be a dry cough, but you probably won't experience anything negative.
I don't understand how health insurance works in the U.S.
Do you have health insurance through your job?
I am a part-time employee, so that is not part of my benefits package.
You can buy health insurance based on your income.
How exactly does that work?
If you go to healthcare.gov, you can see what plans you are eligible for.
Then what happens?
You pay a fee every month and choose a primary care doctor from your plan.
What is a primary care doctor?
A primary care doctor is the doctor you visit when you have a headache or regular checkups.
Do I go to my primary care doctor in an emergency?
No, in an emergency, you just go to the closest emergency room.
This is 911. What is your emergency?
I think my wife just had a stroke or a heart attack.
Can you describe her symptoms?
She is unconscious but breathing and she won't wake up.
We are sending an ambulance right now.
How do you know my address?
We can track it down through our phone system.
How long will it take for the ambulance gets here?
It should be there in less than 5 minutes, sir.
I think I hear the ambulance coming now.
Please let the paramedics in so they can take your wife to the nearest hospital.
Thank you. I'll open the door. I cut myself pretty badly with a knife. I think I need stitches.
Come inside so the triage nurse can stop the bleeding.
I was just preparing dinner and my hand slipped.
This cut does need stitches, but I stopped the bleeding for now.
Will you give me the stitches right now?
No. Since the bleeding has stopped, you have to wait in the emergency room waiting area.
What do I do while waiting?
Fill out these registration forms.
When will I get my hand stitched up?
Here in the ER, we take care of people based on how bad their injury is.
I was here before many of these other people.
Some of them are in worse shape than you. I woke up with the worst stomach ache.
Did you try to go to the bathroom?
I went to the bathroom, but that didn't make the pain go away.
Did you eat anything strange last night? Maybe you have food poisoning.
No, because then I would be vomiting.
Where exactly is the pain?
It hurts here, on my right side.
That's where it hurt when I had to have my appendix taken out.
It's probably just gas.
Did you take any medication?
I took an antacid an hour ago.
It should have worked by now. This could be serious. Why are you holding your mouth?
I think I cracked a tooth. It hurts so much.
Did you look in the mirror?
No, but I can feel a sharp pain when my tongue touches my molars.
That sort of thing can be infected easily.
What should I do?
You should find an emergency dentist.
That is going to cost so much money.
Yeah, but it's better than being in pain.
Do you think they'll have to pull the tooth?
Maybe they'll just have to seal it up.
Get me the yellow pages so I can find a nearby emergency dentist. I have a really bad headache. What do you recommend?
You can purchase some over-the-counter pain relievers in aisle 6.
Do I need a prescription for those?
No, you just pick whichever brand you prefer and pay for it at the register.
There are so many choices.
If you read the labels, you can pick the one that's best for you.
Is there a difference between the name brand pills and the store brand pills?
Usually there isn't. Just compare the labels and look for the active ingredients.
The store brand is less expensive.
Usually it is just as effective.
I sure hope so, because I want to save money and not have a headache.
I think you can achieve both things. My doctor gave me this prescription.
Can I have the paper and your insurance card?
How long will this take to be filled?
We can have this filled within an hour.
Is there any way to fill it faster? I'm in so much pain.
Unfortunately, there are other prescriptions to fill.
What am I supposed to do for the hour?
We can call you when the prescription is ready.
So I can go home and take a nap?
Just leave your number here and the pharmacy, and we'll call you.
Can I send someone else to pick up the prescription?
Your medication is a controlled substance, so the person needs to be over 18.
I'm calling to see if the results of some tests I took are in.
I can check for you. Can I have your name, please?
Sure, my name is Willie Foster.
Mr. Foster, your doctor is Dr. Edwards?
Yes, that's right.
Can you tell me when the tests were taken?
I was there last week.
I see your results are in, Mr. Foster.
Great, can you read them to me?
Actually, I cannot. You need to come in and see the doctor.
Are they that bad? Am I dying?
Sir, I'm just the receptionist. Why don't you come and speak to Dr. Edwards? Hello, this is Isabelle Foster.
Hi, Isabelle. Why are you calling? You can just come to my office.
I'm actually not in the office right now.
You aren't? Well, why not? Is everything okay?
Actually, everything is not okay. I'm pretty sick.
I'm sorry to hear that.
I'm not going to make it into the office today.
There's no way you can come in just to finish that report?
If I come in, I may give everyone what I have.
Well, what do you have?
I have a really bad stomach flu.
Ew, yeah. In that case, stay home.
What brings you into my examination room today?
I'm here because your receptionist told me I needed to come in and discuss my test results.
Well, let me take a look at your file.
The receptionist made me nervous when she wouldn't tell me what the results were over the phone.
Legally, she can't tell you the results.
So, is it bad, doctor?
Your cholesterol is a little high.
Does that mean I'm going to die?
Let's not exaggerate.
I'm going to be okay?
If you change your diet and exercise more, you will be fine.
I will do whatever it takes to be healthy.
I'm calling because I need to reschedule my appointment.
What was the original appointment date and time?
I'm supposed to come in on Thursday at 10 in the morning.
Are you Tina Williams?
That's me.
When would you like to reschedule the appointment for?
Can Dr. Harris see me next Thursday at 10?
He doesn't have an opening that day until noon.
I'll have to come in on my lunch break then.
So shall I give you that appointment time?
Yeah, put me down for that time.
Just let us know 24 hours in advance if you need to cancel or reschedule. Can I have a minute?
What is going on?
I'm not really feeling very well this afternoon.
Oh, I'm so sorry to hear that.
Do you think I can leave the office early?
Well, I have some medication here on my desk.
I already took some pills and they aren't really helping.
It's just that we have a report due today.
I already gave Dennis what I have so far.
He knows how to finish it?
I emailed him detailed instructions.
All right, go home then. But leave your phone on so we can call you if we have questions. I'm here to have some blood tests done.
We take all the samples in the back room, so please follow me.
I usually have blood taken at the doctor's office.
More and more doctors are outsourcing that to private labs now.
It's kind of a pain because I have to make another appointment to go somewhere else.
I understand, but we are professionals.
So you won't mind if I scream when you take blood?
Are you a screamer?
Sometimes I even faint.
I have a very gentle touch.
I'm going to close my eyes.
Well, first you need to fill out these forms.
I'm so sick of being sick.
Have you been taking any medicine?
I have been taking every over-the-counter medicine in the pharmacy.
Maybe you need a prescription for an antibiotic.
I went to the doctor and he says it's viral, so no antibiotic will help.
Have you tried any home remedies?
What do you suggest?
You can try sitting in the bathroom with the shower running so it's all steamy.
What will that do?
It will help with the congestion.
Yeah, but I can't sit in the bathroom all day.
Do it in the morning and before you go to bed. I need to make an appointment to see Dr. Taylor.
Are you already a patient of Dr. Taylor?
No, this is the first time I'll be seeing him.
What kind of appointment is this?
It's for my annual physical.
Can you tell me what insurance you have?
I have Blue Cross.
The earliest appointment I can give you is Wednesday, September 3rd at 10 in the morning.
That works for me.
Please bring your health insurance cards when you come in on that day.
Will you send me a reminder in the mail?
If you give us your phone number, we will remind you the day before. Your blood pressure is very high.
What does high blood pressure mean?
High blood pressure or hypertension means that there is a lot of pressure on your arteries.
That doesn't sound very good.
It isn't very good because it means you are at a higher risk to develop heart disease.
I feel fine though.
High blood pressure is called a silent killer.
What causes high blood pressure?
It could be the sign of some other diseases.
I'm already taking medication.
You should tell me all the medications you are taking because some meds cause high blood pressure.
I better change my lifestyle. Wow, you really look terrible.
Thanks a lot. I really feel awful.
I'm a nurse, so you should tell me your symptoms.
Well, to begin with, my whole body aches.
Have you taken your temperature to see if you have a fever?
I have, and I'm running a slight fever.
Sounds like you might have the flu.
That's impossible because I got my flu shot.
You can still get the flu even if you get vaccinated.
Well, that makes getting vaccines pointless.
Not really, because you will probably get over it quickly.
I'm going to make some tea and lie down.
What brings you in to see me today?
I'm here for my annual checkup.
Well, the nurse already took your blood pressure and she said it looks a little high.
That could be related to my thyroid medication.
That could be. Let me listen to your heartbeat.
Does it sound good, doctor?
Sounds nice and strong to me.
I am concerned about some pain I've been having in my knee.
Are you very physically active?
I'm training to run the marathon.
That puts a lot of pressure on your knees.
I hope I don't have to stop training.
Help, I need the doctor immediately.
What is the problem, sir?
I think my wife had a stroke.
What symptoms does she have?
Look at her, she's awake, but in a catatonic state.
How long has she been like this?
She's been like this since this morning.
She should be taken to the hospital.
But this is the doctor's office. You can't help her?
She needs to see an emergency specialist.
What can you do for her?
We are going to have her transferred to the nearest hospital. We think your leg may be broken.
How will you know for sure?
We're going to take you to radiology to get it x-rayed now.
Will the x-ray hurt?
It's a pain-free procedure that allows us to take a picture of your bones.
Are there any side effects associated to taking an X-ray?
Diagnostic X-rays are safe as long as they are not overused.
I've never had an X-ray in my entire life.
Then you should be fine.
Can someone be in the room with me?
Someone can be in the room with you, but not next to you during the X-ray.
Please go get my wife then. I'm so glad you could squeeze me into your schedule today, Doctor.
Sure. What seems to be the problem?
I was in a small car accident last month, but only recently noticed some neck pain.
Is there any bruising?
Not that I can see.
Show me where the pain is.
The pain feels like a sharp stabbing followed by a dull throbbing.
I don't see bruising, but there could be nerve damage.
So what do I do next?
I'm going to refer you to a nerve specialist.
Do you think I can sue?
Is that what this is all about? Doctor, I have a few questions I would like to ask.
I'd be happy to answer your questions.
Based on my test results, do you think I should be taking a multivitamin?
Your levels are all within normal range, so just eat vitamin-rich food.
I'm trying to get pregnant.
Then you should take a prenatal vitamin.
Those are expensive.
An alternative would be to eat food enriched with folic acid.
What foods are enriched with folic acid?
Some cereals and breads are now enriched with folic acid.
What if I'm staying away from grains?
Then you should take a vitamin with folic acid.
In order to check for an infection, we're going to need a urine sample.
How does that work?
Take this little cup and pee in it.
Do I have to fill the whole cup?
If you fill it halfway, it will be fine.
What do I do with the cup?
Put it in the plastic bag and leave it on the tray in the bathroom.
No one else will take my sample?
The nurse will take it when you leave the bathroom.
I'm glad I drank some water while I was in the waiting room.
We would have given you water and waited until you needed to use the bathroom.
You don't need to wait because I'm ready to use the bathroom now. Do you have any tips on how to stay healthy?
How do you think I got to look this good at my age?
Let me guess, you drink a lot of water.
I drink at least 8 glasses a day.
I bet you exercise every day too.
I try at the very least to walk 20 minutes a day.
I didn't think walking was good exercise.
Walking briskly is great exercise.
What about eating habits?
Try to eat as much non-processed stuff as possible.
What do you mean non-processed?
If it's in a can, a bag, or a box, it's probably processed. I saw a commercial about a heart medication.
You don't have any heart problems.
I know, but the ad suggested I ask my doctor if that medication was right for me.
As your doctor, I can tell you that you don't need any heart medication.
Okay, what about this medication that has the commercial with the couple in the bathtub?
What about it?
Can you prescribe that to me?
The only thing I'm prescribing you is an antibiotic for your strep throat.
What do I do with this piece of paper?
Take it to the pharmacy and the pharmacist will give you the antibiotic.
What if it doesn't work?
Come back to see me again.